Okay, so today we're going to talk about caffeine improves basketball performance in experienced players. For the introduction, ergogenic ads have gained popularity in recent years, and many athletes have used them for maintaining physiological condition, enhancing muscle damage recovery and performance. Caffeine is one of the most consumed substances because of its affordability and positive physical effects. Previous studies have focused on the high-intensity movements and speed during sprints for team sports. While the study results show inconsistency, the caffeine intake has found effective in real game settings, such as hockey, rugby, and volleyball. In comparison, basketball performance involved more of the cognitive and skill-based demands in coordination of decision-making components, including dribbling, shooting, and passing. While the effect of caffeine on improving physical performance is well known, its impact on accuracy and decision-making actions requires further investigation. Based on what is said above, the ergogenic effects of caffeine on basketball performance is inconclusive. The purpose of this study is to determine whether caffeine is an ergogenic aid for experienced basketball players. By conducting numerous specific tests and stimulated games, the caffeine's potential can be assessed. The hypothesis of the research is the pre-exercise injection of 30 mg of caffeine per player's body weight will improve physical performance in basketball specific tests, but it will not affect game-related statistics.
The research methods included 20 participants, 10 professional female basketball players, as well as 10 semi-pro male basketball players, all within the age range of 20 to 33. And they had the requirements of having no medications, no injuries at least 1 month prior to this test. All must have been active at least within the last 10 years and have a daily intake of caffeine of no more than 100 milligrams. For their pre-test a week prior, they were eating a diet of 60%, 16%, and 16% carbs, 16% protein, and 24% fat, respectively, and had their free fat mass measured and adjusted for their caffeine dosages. The results of the design of the actual experiment itself included a double-blind, placebo-controlled, and randomized experiment that was counterbalanced so that at least every player received 1 placebo and 1 caffeine tablet each session. They were on 2 separate occasions under the same conditions at the same time, tested with a week in between for rest, and the test started with a Balikov jump, Kodak test, and 2 free throws. And the 2 teams played a scrimmage game with 2 professional referees and 2 specialists assessing them. And after they were done, were both given a survey to assess how they felt during and after the game. The results of the experiment were that the mean peak height increased for those individuals who took caffeine on the Balikov test. As for the Kodak and free throw tests, caffeine did not increase the mean performance, but during the scrimmage game, the number of impacts increased significantly with ingestion of caffeine. And also, regarding the player's performance index, 20 categories were assessed by the 2 professionals, but 3 were significantly increased, being rebounds, assists, and free throws during the actual game. Afterwards, for the self-exam, the self-perceived muscle power was significantly higher, but after 24 hours, higher levels of insomnia were reported by those individuals who ingested caffeine.
With this study, the researchers found out that the caffeine does help the professional athletes to improve their jump height and overall performance. However, caffeine did not modify accuracy. Taking 3 mg per kilogram of body mass is considered as an effective ergogenic substance to increase physical and overall performance of not only basketball players, but also for professional badminton and volleyball players. While this study was successful in investigating the effect of caffeine on physical performance, the information about the translation of the physical benefits of caffeine to overall sports performance is scarce. For example, caffeine increased the number of free throws attempted and made, while it did not improve the accuracy and other skill-based technical actions. But since caffeine increased the number of assists and the number of total and offensive rebounds for basketball players, which is the key factor for basketball performance, it is concluded that caffeine helped to bring out a successful result. It is discussed that pre-exercise ingestion of caffeine increased insomnia with no other measurable side effect. It is possible the negative effect of caffeine is related to the experimental design, which all trials are being performed in the evening with less than 6 hours from caffeine intake to the bedtime. They should be aware that taking caffeine increases the chance of insomnia for the players. It is also discussed that pre-exercise meal timing may have the potential to influence the effects of caffeine on basketball performance. Eating before exercise may interfere with the absorption of caffeine. It is suggested that eating should be separated from ingestion of caffeine to avoid any potential interference in caffeine absorption.
In conclusion, the researchers found that when athletes consumed 3 milligrams of caffeine per kilogram of body weight before exercise, there were increases in the Abalakov jumps, amount of body impacts during a simulated game, the number of free throws attempted and made, total rebounds, and total number of assists. All these statistics led to a higher basketball index rating, which is a measurement of overall basketball performance. On the contrary, there were some negative effects from taking the dose of caffeine, such as sleep disturbances and sleep apnea. The researchers did note that the use of caffeine should be restricted to physical challenges such as competitions and/or high-intensity trainings to avoid habituation and dependence for those players that have maximized performance through appropriate training and dietary habits, and also taking into account its effects on sleep quality. Overall, the results of this study show that caffeine could be considered as an ergogenic substance to improve overall performance in basketball.